Inductions can bring more choices, and that can seem really scary. So how do you manage all those choices and learn to make them confidently on your own? Today, I'm going to give you 3 tips to managing choices in labor to bypass that birth trauma and feel good about your upcoming hospital birth. And ultimately, start your parenting journey on the right foot. Now, I am here to tell you that when you're learning about choices, you need to learn about them from an unbiased expert. Too many people put their birth values on your upcoming hospital birth, and as a nurse, you learn to stop doing that very quickly because of the huge population that you serve, and everyone values something different. So in case we haven't met yet, hello, I'm Hilary. I'm the pregnancy nurse. I've been a nurse since 1997. I have 20 years of labor and delivery experience, and I'm so glad that you're here to talk about making choices in labor. And specifically, even an induction. Now, the first thing that a lot of people choose is to just sort of lie around and be scared of the choices that they may end up facing, or to put their head in their sand like an ostrich. Now, I did this thing. If you watched a previous video of mine, I talk about how I cried the day before my induction for absolutely no good reason. I'm here to tell you that the internet feeds this. The internet loves to feed the fear. There are a lot of doulas who like to feed the fear because it increases their business. There's a lot of people who choose to use a doula so that they can make choices for them. And I'm here to tell you that a good doula does not make choices for you. They help you get the education that you need. But ultimately, it is always your choice to make the choices. And most of your life, you've lived as a healthy young adult. And so when you get in the hospital and suddenly you're having to make these healthcare choices, it's really new and sometimes startling. While we're here, can you tell me a choice that you are nervous about? Tell us down in the comments. And I'm here to tell you that it's normal to feel like a lot of these make you a little bit nervous, even as Hilary, the pregnancy nurse, had babies of my own. Okay, the next one is that you cannot make choices in advance. I see so many people online saying, oh, I'm not going to get induced. I'm not going to get an epidural. I'm not going to have a C-section. And then as you follow them a couple weeks later, they end up making one of those choices because you really cannot make the choices in advance. And I'm here to tell you, I really wish that you could. I really wish you could make choices for advance for a lot of the things that are happening in our lives. But as labor progresses, there's a lot of circumstances that change very quickly. Be it needing to be induced or having a C-section or even getting an epidural if things are just very different than you thought they would be. And like you and me, we've played some video games in our time, right? And as you play the video game, it gets more complicated. And pregnancy is sort of like that. You know, like when you're in the last levels of Frogger, you're constantly like having to jump different places. And pregnancy can really feel like that. And so you need to get good at making the choices during your whole pregnancy so you can really be good at them when you're in labor. Now, I am here to tell you that you can learn how to make choices in labor with the assistance of your expert healthcare team, because they're going to be the expert on what's going on with you and your pregnancy and what the data shows moving forward. But you are the one who makes the choice, not them. I'm here to tell you that you need to learn to make these choices from an unbiased expert who has seen thousands of people make these choices in labor. Learning to manage the gray area, because I'm here to tell you that there is a lot of labor and delivery that is very much a gray area. Your doctor or midwife may make it seem very black and white, but in reality, there is so much gray in which you can make a choice that both balances what you want for your upcoming birth and also what's going on right at that time. And don't worry, I'm actually going to give you what you guys need to make those choices so confidently. You guys are going to absolutely love it, so stay tuned. And I'm also here to tell you that you should never feel forced into something. If you are feeling forced, it is time to take a pause and get more information from your provider so that you can make the upcoming choice. Now, I am here to say that sometimes providers don't give you the option to make a choice. I have heard of providers who say, we are scheduling you a 37-week induction. That is not the language we should be using, and we need to let providers know that that is not okay. But it is always your choice. If they make a comment like, we are scheduling you a 37-week induction, that's when you go, whoa, 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 I need some more information. Can we talk more about that so I can make the choice if I want to be induced? That is, again, taking the reins back for yourself so that you are the one making the choice, not your provider. You probably have not made a whole lot of healthcare choices in your life so far. Your parents probably made a lot of healthcare choices for you when you were a kid. First off, you need a foundation of knowledge. The reality is your provider is very busy. I wish it wasn't that way. I wish they could spend a lot of time with you at appointments and before birth, but they simply cannot because they need to see a lot of patients. And so I am here to tell you that you really need to get just the basics of birth down on your own so that you can discuss how they relate to you and your upcoming birth with your provider. You need to learn from an expert who gives evidence-based advice that you can apply to you and what you want. And I want you to get an inner confidence created through education, that you feel good about both your own knowledge and your healthcare team. Come join me in the online prenatal class for couples, where we really get you prepared to make choices in your upcoming hospital birth. In fact, we get both of you prepared to make those choices, because it's so nice to have a teammate instead of just a cheerleader in the game with you. The online prenatal class for couples is affordable. You'll be surprised at the price points. It is created to be done with your partner to get you both prepared, and it only takes a few hours. The basic class is just 3 hours, so if you're telling yourself you don't have time, you can smush my 15 to 20-minute lessons easily into a few days and be prepared before you even know it. It truly is the easy button in getting prepared for your upcoming hospital birth. And when you guys go to that page, I'm going to link it down below. Be sure and check out the reviews, because there are a lot of people who have felt like you before taking the class, and then they realized how easy it was to get prepared and how confident they felt going into their labor and birth. If you guys have questions about the class, tell me down below. I'm so glad that you're here learning about how to make choices in your upcoming birth. Thanks for hanging out with me here at the Pregnancy Nurse.